Osteoporosis is a common disease all over the world. Bone loss, a silent process affecting millions of individuals around the globe, is often overlooked. Currently, osteoporosis affects 1 in 5 adults aged between 18 to 59 years in India. Osteoporosis that is not treated can lead to serious bone breaks, especially in the hip and spine. Many people think osteoporosis is simply linked to old age. The older we get, the more chance we have of developing osteoporosis. While that is true in some ways, age isn't the only factor involved, and osteoporosis is linked to various other medical conditions. You'll be surprised to know that even hormonal imbalances can cause osteoporosis, and the good part is that there is a lot you can do to protect your bones throughout your life. You're never too young or too old to improve your health of your bones. The cornerstone of the prevention and management of osteoporosis is to improve knowledge and awareness among the general public. Today, we have with us eminent endocrinologists who can help you understand and manage osteoporosis. Dr. Hemant Phatale, consultant endocrinologist, Samrat Endocrine Institute and Diabetes, Obesity and Thyroid, that is in Aurangabad. Dr. Ashish Sehgal, consultant endocrinologist, Dr. Ashish's Endocrine Clinic in Karnal, and Dr. Arjun R, a consultant consultant endocrinologist at Aster MIM's Kannur. Let's head straight into our discussion now. Hormones are essential to the overall well-being of our body. What type of body functions are affected by hormones? Dr. Hemant Phatale?
Yeah, it's true. It's more than 50 hormones are being secreted in human body, and these hormones control or regulate various body functions. There are two types of hormones: peptide-based and steroid-based. Peptide-based are water-soluble, while steroid-based are fat-soluble, which can easily cross the cell membrane. So, if you look at these hormones, as it's said, control or regulate, it has various functions. Right from this, it helps in food metabolism and thereby control of body temperature. It regulates your thirst as well as hunger. It regulates your mood and the cognitive function as well. It helps in creating and maintaining the sexual health and reproductions. And at the same time, it is important that it helps in bone building, bone breaking with the help of the parathyroid hormones and the minerals like calcium, phosphorus, and the sex hormone like estrogen as well as the testosterone. And so hormone maintains the harmony of life. Disharmony leads to the disturbed physical, mental and the sexual health. Disturbing bone health may lead to a crippled life. That's how the hormone is important in anybody's life.
So, how can thyroid problems weaken your bones? Does levothyroxine medication weaken the bones, Dr. Arjunar?
Yeah, so thyroid hormones do affect the rate of bone replacement in the body. So, in simple terms, what you can understand is that too much of thyroid hormone in your body speeds the rate at which bone is lost. So, if this happens too fast, the osteoblasts, which are the bone forming cells of the body, these osteoblasts may not be able to replace the bone quickly enough. So, if your thyroid levels in your body stay too high for a long period, or if the TSH is suppressed for a longer period, there is a high risk of developing osteoporosis. So if you have hyperthyroidism or an overactive thyroid gland, the first step is to treat the overactivity. So once the level of thyroid hormones in your body has been reduced to a normal level, the bone strength may improve. And hypothyroidism as such, or an underactive thyroid gland, is not a risk factor for osteoporosis. But as you had pointed, if you are on levothyroxine supplements, it is important that you always see your doctor on a regular basis, get your thyroid function test done, and make sure that your thyroid hormone levels are not at a very high level so as to prevent accelerated bone loss.
Okay, but what is parathyroid gland and how does parathyroid hormone cause osteoporosis? Dr. Ashish Sehgal.
Yes, see, parathyroid glands are very small glands, 4 of them in number, and the size is of that of a grain. And they are located deep inside the thyroid, and they are very small, but they are tasked with the production of a very important hormone called parathyroid hormone or parathormone. Now, what this hormone does it is tasked with the maintenance levels of serum calcium in our bloodstream. And why it is important? It is important because calcium is very, crucial for the normal functioning of our muscles, our nerves, our nervous system. Almost all cells of our body require normal levels of serum calcium for their cell membrane activity. And minute-to-minute regulation of serum calcium is what is the function of parathyroid hormone. Now, when there is excess of this hormone in our bloodstream, that is what is known as hyperparathyroidism. It can be directly because of a tumor of the parathyroid gland themselves, or it can be related to some other problem in our body somewhere else, when we call it secondary hyperparathyroidism. So when parathyroid hormone levels increase, then we can have reduction in bone mass, osteoporosis. Now, what parathyroid glands or parathormone does is it maintains normal serum calcium levels by reabsorbing calcium from the filtered urine in the kidneys, by absorbing calcium from the food we eat in our intestine. But another important mechanism of maintaining serum calcium levels is by absorbing calcium from bones as well, mobilizing calcium from bone calcium stores. Under normal physiological conditions, this does not lead to bone loss. But when there is hyperparathyroidism, when there is excess of parathormone, then there is excess mobilization of calcium from the bone, and then when it pertains for a certain period of time, it gradually leads to loss of bone mineral density and osteoporosis. Now, there's a paradox here. Parathormone excess leads to osteoporosis, but osteoporosis is sometimes treated with parathyroid hormone as well. The difference is chronic excess leads to bone loss, but when it is given in a pulsatile way, then it can lead to increase in bone mass as well. So we have parathyroid hormone analogs and synthetic parathormones available for treatment as well. Nevertheless, chronic excess leads to loss of bone calcium and hence osteoporosis.
Can osteoporosis caused by hormonal imbalance be managed well with prevention and lifestyle changes? Do we still have medicine to manage bone health? Dr. Hemant Phatale?
Yeah, the word, as I said, is osteoporosis. That essentially means a porotic bone. They are porous and easy to break. And this bone formation in terms of length, it starts from in utero, and it is till the completion of puberty, the bone length is increasing, and later on the mass is also increasing. And after the adolescence, this bone making and breaking is a continuous lifelong process. This making is more till the age of third decade, and after that breaking is more than the making. And women up to 50% of their bone mass is lost during their lifetime, while in men it is almost 25 to 30% bone loss in their lifetime. And see, if you don't want to break the bone, then don't fall is the dictum. And if you don't want to get fall, then you need to modify your lifestyle. In terms of diet, which should be rich in calcium, and buffalo milk will give 1 ml is equal to 2 milligram of elemental calcium, while cow milk in a pure form 1 ml is equal to give to 1 milligram of calcium. Besides, there are certain fruits also like chiku or maybe custard apple or various food items will also contains high in calcium, that should be followed. And besides that, there should be adequacy of vitamin D is very important. See, inadequate vitamin D will not respond to any sort of the osteoporosis management drugs will not act properly. Vitamin D is very important for the bone building as well, and proper functioning of parathyroid gland. Dr. Ashish was talking about the function of the parathyroid gland, and that is also vitamin D dependent. Though it is called vitamin D, it is actually a hormone by definition. And this vitamin D is produced below the skin, under the sunlight with specific ultraviolet rays that is available between 11 to 1 o'clock, And for Indian skin, 45 minutes sun exposure is required for adequacy of vitamin D. And besides this diet change, we need to have a increased muscle balance, muscle mass, and for that we need to have a anti-gravity muscle strength. That exercise should be regularly be done at least 150 minutes in a week, and that can be a simple walking or maybe jogging or maybe cycling or maybe staircase climbing as well. And besides the extensor muscle exercise also equally important. And so with this diet and exercise, the frailty is decreases, the imbalance will be decreases. At the same time, one should, if you are habitual of either tobacco or alcohol, should need to stop that as well. And besides all this, we need to take a note that all bathrooms are slippery bathrooms, and the dry bathrooms concept should be placed so that if you look at the old age, many mishaps occurred in bathroom itself. So that can be prevented with adequacy of the muscle strength and avoiding the slippery surface as well.
Now, menopause and just after menopause is a time when osteoporosis commonly presents itself. Why does menopause cause osteoporosis, Dr. Arjun?
Hi. So as you had rightly pointed out, preventing bone loss is an important concern for women during menopause. And as Sir had highlighted, older women are more at risk of osteoporosis and are more prone to fractures. So if we look at the physiology, what happens is women reach their peak bone mass at around an age of 25 to 30 years. So this is when their skeleton has stopped growing and their bones are strongest and thickest. So the female hormone of estrogen plays an important role in maintaining the bone strength. So at the time of menopause, what happens is estrogen levels drop, and this results in accelerated bone loss. So research shows that on an average, women lose up to 10% of their bone mass in the first 5 to 10 years after menopause. So this is one reason. Another reason which we can attribute to the increased bone loss is menopausal women are at a higher risk because they are not getting enough minerals that help to maintain healthy bones. So when you aren't getting enough calcium, what your body does is it uses the calcium stored in the bones, leaving the bones weakened and more vulnerable to fractures. So these are some of the reasons why menopausal women are more prone to osteoporosis and fractures.
Now, at what age should one go for regular bone density tests? The tests are available to diagnose osteoporosis. Are they, Dr. Ashish Sehgal?
Yes. The gold standard test, and which is easily available for measuring bone mineral density, or rather aerial bone mineral density, is DEXA. So DEXA is the gold standard, and it stands for dual energy X-ray absorptiometry. It is just like a routine X-ray, but it exposes us to much less radiation. Routinely, should be done in women, as the global guidelines recommend, beyond 65 years of age. So for women beyond 65 years and for men beyond 70 years of age. That is when we should be doing it weekly, and if everything is normal, it can be repeated even 5 or 10 years after that. However, if individuals are less aged than that and they have risk factors for all, like somebody is underweight, somebody consumes lots of alcohol, somebody has rheumatoid arthritis, somebody is on certain medicines like steroids or as hypogonadism, and as we discussed, hyperthyroidism or any other problem that leads to develop osteoporosis. When anyone has any of these risk factors, then a routine screening BMD can be performed earlier as well, as dictated by the situation. So what we do in a BMD DEXA is that we compare the individual's bone mineral density in gram per centimeter square to that of a young healthy female of the same ethnicity. And then we derive something called a T. And T score less than minus 2.5 is termed as per the guidelines as osteoporosis. Now, why do we want to test BMD and why do we want to DEXA? Because we want to predict whether or not an individual is going to develop a fragility fracture. So there is another way of calculating that probability, and that is what is fracture. Frax tool is a very good and easily calculated score, and it is available online. Can search it and we can avail it, and it is available for the Indian ethnicity people as well. We can input certain variables like age, gender, height, and so on and so forth. And what Frax tool does is, it gives us the 10-year probability of developing a major osteoporotic fracture. So we can use that probability to decide whether or not an individual requires treatment to prevent the development of a future fragility. So BMD can be done, yes. For some reason that's not available, we can easily avail the fact online and calculate the probability of development of a fragility factor in the future.
All right. On that note, we'll take a very quick break, but we'll be back with a discussion on the same issue. Stay with us. Welcome back. Let's head back into the discussion. What steps can we take to reduce the risk of osteoporosis during menopause? Dr. Hemant Phatale?
If the menopause occurring prematurely, and that is less than 40 years of age, these women need to be given the hormone replacement therapy. That essentially means sequential pill of estrogen and progesterone, and that is going to prevent the osteoporosis or bone loss. But if this patient is already a naturally occurring menopause at the proper age, and in that case the hormone replacement therapy is not recommended, just because the risk is more than benefit. And in such patient, the adequacy of calcium and adequacy of vitamin D is very important. And in addition to that, there is a weight bearing health exercises are also important, and the dictum which I said previously also, that don't fall. And don't fall essentially means we need to have a more balance and more muscle strength. At the same time, the cessation of tobacco or alcohol, and in addition that we should have a dry bathroom concept, and so in addition to that, particularly in women, that high yield should be avoided. That is going to be reduced a lot chance of fall. With that, there should be avoid the disturbed or confused state of mind is also sometimes that lead to the fall. That also should be avoided. And ensure that there should be adequacy of light wherever you move around. And if you feel that your balance is not proper, then the health, like maybe a rail, the stainless steel rail, should be climbing up the staircase or while getting up from the bathroom. Some support, which is adequate support is needed, so that can be prevented from the fall. Besides all these, we after the age of 40 years, those who have a fragile fracture, they need to be treated. Your doctor will decide which kind of therapy is to be there. If you do a DEXA scan, in such case, if you have osteopenia, and if you apply the fracture risk score, there is a Frax score which is available on net, and you calculate that, and if that score, if chance of hip fracture more than 3%, or chance of generalized fracture more than 20%, in such patients, they need a pharmacotherapy to avoid to prevent osteoporosis or treat the osteopenia, or to prevent the chance of breaking the bone as well. So what kind of therapy? It may be an anabolic, like Dr. Arjun was talking about the parathyroid hormone, or Dr. Sehgal was also talking about the parathyroid hormone sequential therapy, and that is going to be an anabolic part of it. Well, anti-resorptive like denosumab or biphosphonate, that is to be decided by the treating doctor what is best suits for you, what is your situation. At the same time, it can be a sequential therapy to avoid the side effects of the drugs. It can be done, but mind well, adequacy of calcium, adequacy of vitamin D, and maintaining the muscle strength is equally important.
Okay, so what are the treatment options for osteoporosis? Are treatments different for men and women, Dr. Arjun?
People with the highest risk of fractures are the ones most likely to benefit from drug therapy. So we have a lot of commonly used agents. I'll just touch upon how these medicines are given, because that is what is more important. So we have agents such as bisphosphonates, denosumab. Sir was mentioning about denosumab, and teriparatide. These are the most commonly used agents. So bisphosphonates are medications that actually slow the breakdown and removal of bone. So even in bisphosphonates, we have oral medicines, which are, for example, alendronate is available as a pill that can be taken either once a day or once a week. We also have injectable bisphosphonates such as zoledronic acid, which is very convenient. It is actually given as an injection once yearly. So that form of treatment is very convenient for the patient. Denosumab is another commonly used agent, which is under the class of drugs called as rank ligand inhibitors. So that is also administered as an injection under the skin once in 6 months. So the dosing convenience is there for denosumab as well. Other commonly used agents, there is teriparatide, as sir was mentioning earlier. It is a synthetic form of the natural human parathyroid hormone. And this medicine, it is slightly different from bisphosphonates and denosumab. So what this medicine does is it gives the body a chance to form new bone. It increases the bone mineral density and the bone strength rather than reducing the bone degradation. This helps the body to form new bone. And as a result, it reduces the chance of getting a fracture for the patient. As for the treatment options for male and female, it is more or less same. There are some subtle differences. Certain agents such as, not less commonly used agents such as calcitonin, ibendronate have not been approved for treatment of osteoporosis in men. And also in patients, in male patients who have symptoms suggestive of hypogonadism or features suggestive of testosterone deficiency, in those patients, testosterone injection itself can be used as a bone drug in those patients who are at a high risk of fracture as to reduce the fracture rates.
Now, can people who are already suffering from osteoporosis exercise? What general recommendations would you give for exercise to those people? Dr. Ashish Sehgal.
Yes, see, exercise is very important aspect of lifestyle modification that is advised to individuals who are both having osteoporosis or are predisposed to develop osteoporosis. Yes, the exception is somebody who has a current fracture or who has recently recovered from a fracture should not be indulging in exercise until and unless advised by the treating doctor. Otherwise, somebody who has osteoporosis should be engaging in a regular exercise program, which should include both strengthening and balancing exercises. Strengthening exercises can include weight-bearing exercises in which we use our own body weight while we work out, and the examples include just walking, brisk walking, dancing, it can be climbing stairs, and so on and so forth. So these are weight-bearing exercises that can be incorporated in the exercise program. We can also indulge in resistance training, whereby we can use external weight, but that should be done only under expert guidance. And this is particularly true for someone who has not been working out for quite some time. Apart from that, should avoid all these high intensity exercises. Sudden twisting movements should be avoided because that can predispose to develop fracture. Then the other aspect of exercise program is balancing exercise. I mean, there are some exercises that help us build muscles around big joints so that we are able to better maintain a balance and prevent fall. If we prevent fall, we can prevent a trajectory fracture. So yes, exercise regimen 30 minutes per day for most days of the week is actually very much helpful for individuals with osteoporosis.
And doable as well. Many thanks to all the three doctors for joining us here on this discussion. With that, we are taking a very quick break.